Hi, my name is Mark, and we're going to talk a little bit about total knee replacement. Now, if you're watching this video, you either had your knee just replaced or you're about to have your knee replaced. This video is to help set some expectations and to give you some insight into our thought process on rehabilitation after your knee replacement. We're going to talk about managing your swelling, managing your pain, managing your motion, managing your strength, managing your balance, and managing your function. So we got 6 areas we're going to talk to. So let's get into it. So let's talk about managing your swelling. The number one most important thing after your knee replacement is to manage your swelling. Okay? You've had a dramatic injury to your knee, and your knee is halfway down your leg, and fluid is constantly being pulled downward. Your body is about 66% water. So anytime my knee is below my heart, it's going to want to swell. Okay? You need to work on rest, ice, compression, elevation, and lymphatic massage to get that swelling down. We'll have other videos that are designed specifically to go into depth on those, but the RICE, rest, ice, compression, elevation, and lymphatic massage are the keys to help getting that swelling down and keeping that swelling down so your knee can have a solid, proper rehabilitation opportunity. If you don't get the swelling down, you're not going to get your motion back. If you don't get your motion back, you're not going to function well. So the number one key, get the motion back by getting the swelling down. So now we're going to talk a little bit about range of motion. The reason God gave you a knee is because He wanted your leg to bend halfway between your hip and your ankle. He needs it to be able to straighten, and you need it to be able to straighten, and you need to be able to bend. We're going to work on talking from a goal of 0 degrees straight or perfectly straight and about 120 to 125 degrees bend. That's what the prosthesis allows. Now, if your knee was radically bent or stiff before surgery, those may be unrealistic expectations, and your surgeon will let you know that. But for most patients, getting to 0 and 120 is very achievable. The challenge with getting your motion back is it takes stretching, and stretching right after surgery can be very painful. If you can get control over your swelling and you can get control over your pain, you can get your motion back. If your knee is big and swollen, it's like trying to bend and straighten a water balloon. It's not going to work. And if your knee is so painful that when you try to stretch it and try to bend it and try to straighten it, that it's so painful it stops you from doing it, you're not going to get your motion back. Manage your swelling and manage your pain, and you'll be able to get the motion back in your knee that you need to recover. So once your swelling is coming under control and your motion is making good progress, then we start working on strength, or what we would consider low-level strength exercises, any kind of muscle contraction exercises, kicking out the leg straight and contracting the muscle nice and strong, pulling the knee back and contracting the muscle nice and strong, mini squats, those types of things. Those come after we get good control over the motion and good control over the swelling. Now, there are a lot of strengthening exercises that are great for you. Depending on where you were at before surgery, you may need strength exercises for your hip, as well as your knee, your lower leg, your spine, your abdomen. Your therapist is going to help guide you in what strength exercises you need and are most important. But the key to strength training is having that foundation of management of your swelling and management of your range of motion before you do too much strength training. If you emphasize strength, you'll get stronger. But if you don't get your motion back, your knee will never function as you want it to. So strength only happens after the swelling and after the motion are returning well. Strengthening exercises usually don't bother the patient too much. They're not nearly as painful as the stretching for motion exercises. So a lot of the patients gravitate towards those early. They want to do their strengthening exercises, as well as their mobility exercises, like walking. Right after total knee replacement, I encourage my patients not to measure their success by how far or how long they can walk. Walking puts a lot of pressure on the knee. Pressure will cause swelling. And when you walk, you use very little motion in your knee. Even if you had a perfect gait, it doesn't use that much motion in your knee. So we're getting a lot of pressure and very little motion. What we need for a successful knee replacement recovery is very little pressure and little swelling and a lot of motion. So I want you walking, but I only want you walking for short periods of time. And I want you walking with perfect form. Before you get rid of your walker, you need to be able to walk with perfect form with your walker. If you can walk with your walker with great form for 5 minutes and then your form starts to fade, your limited time is 5 minutes on your walker. If you can walk with your walker great form for 5 minutes, then I may allow you to walk without your walker for a few minutes. Again, it's based on form. You need to earn the right to progress. If you're walking horrible with your walker, I'm not going to take your walker away and expect you to walk well without it. Okay? Don't measure how well you're doing by how long you can be on your feet. Measure how well you're doing by how well you're managing your swelling, how well you're managing your range of motion. The gait and the strength will come with time. But once it's time to work on those types of things, measure your progress by, can I do it with great form? Can I do it well? It's more important to move well than it is to move more at the beginning stages. Manage your swelling, manage your pain, manage your motion, then we start managing your strength and mobility. So once we have good control over your swelling, your pain, your motion, and your strength is coming along, now we focus on balance and coordination. Those are the final things we need. And we're kind of working them along the way, because when you're walking, you are balancing. But now it's time to focus on your final strength training exercises and your balance exercises. And the reason I kind of pair those together is because when you're working balance, you are working strength. You can't do balance exercises without good strength. But those are your final stage of exercises. By this point in time, the walker is gone. You're walking smooth without it. You've got good range of motion in your knee. The swelling is under control. Now we can get into the more aggressive strength training and more aggressive balance exercises. But those are the final things to come. And once you've reached this stage, you're getting to where you don't need your physical therapist anymore. You can run your own rehabilitation program. You should be healing well. You should understand everything that you needed up to this stage, and you just take it and run with it for the rest of the year. You get stronger and you get better balance. Your knee will eventually be as good, if you train it with regard to balance, as your original knee, if not better. But balance takes focus training, and some time and dedication to do it. Just like strength training takes time and dedication to do it, just like motion took time and dedication to do it. But those are your final stages of rehabilitation, are the strength and the balance. And if you're at that point in your rehab, you've had a successful rehabilitation. So just to sum it up, realize when you just had your knee replaced and you're working through the rehabilitation process, your number one goal, manage the swelling. Number two, manage the motion. You need control over the swelling and pain to do that. Number three is strength, or low-level strength exercises. And then the last one is your higher level strength exercises in balance, mobility, getting back into life, those types of things. But those come at the end. Don't get the cart before the horse. Work at them through the process. And just like riding that rehabilitation wave or driving down the road of rehabilitation, constantly analyze your situation. Look at where you're at. Do you need to speed up? Do you need to slow down? Are you too far ahead of the wave? Are you off the back of the wave? Base those on how's my swelling, how's my pain, how's my motion, how's my strength, and how's my balance. Focus on the areas you need to focus on, and don't ever forget, it's more important to move better than it is to move more in the early stages. Good luck with your rehabilitation. I hope to see you down the road and see a successful outcome.